Hi, so I'm Dr. Simon Drysdale. I'm a consultant in paediatric infectious diseases and immunology at St George's University Hospital NHS Foundation Trust in London in the UK. So I currently work as a clinician and an academic in paediatrics. So on my clinical time I work with children with significant infections as well as those with suspected and confirmed immunodeficiencies. I also work as an academic, predominantly around RSV infection and other respiratory viruses, including COVID-19 recently.
Hi, I'm Kate and I'm a mum of 6. I have 2 older children and 2 sets of twins. I live in Leeds in the north of the UK and I run a business called Mini First Aid, so life's really busy for us. We're juggling 6 children through preschool and school, as well as running a first aid training company. So life is very, very busy. But I get to do what I love, which is teaching first aid, and we teach over 1,000 families a week first aid in the UK, and are looking forward to some European expansion as well, which is really exciting.
I started training in paediatrics, and after a few years got the opportunity to do a PhD, which I undertook looking at children, prematurely born children with RSV infection and other respiratory viruses. And since that time I've continued my academic work in RSV and also looked at done work on other respiratory viruses. So I've led various clinical trials around therapeutics, vaccines, monoclonal antibodies, particularly around RSV infection.
My twins, both sets of twins, have all experienced RSV at varying levels of severity, and I think the first of our children to get RSV was twins, so of course it meant that they both had the infection, but it was, for me, it was the unknown, because it was going into hospital with babies with this very fast breathing rate, tugging here, and being seemingly unwell, but I didn't know anything about RSV. I just thought that they had a cold and they'd got more poorly, and actually it was the help from the nurses when they were admitted for oxygen and tube feeding that was enabled me to learn a little bit more about RSV, and it was just something I didn't know.
Lots of infants and children are now becoming infected with RSV outside the traditional winter months, and this is particularly the case in the Netherlands recently, and we're also seeing the same thing in the UK. Had a big spike of RSV around August, which is very unseasonal. Evidence is still somewhat lacking, but it seems to be that this is due to the various lockdown measures and other social distancing and non-pharmacological interventions that have been instituted due to the pandemic, meaning that there's been much less exposure, and therefore over the last year a waning of immunity, because adults and older children haven't been exposed to RSV infection, and therefore there's a couple of cohorts of newborn babies and infants who've never been exposed to RSV. And so, as well as seeing the traditional under 1s with severe RSV infection, this year we've also seen some slightly older children between 1 and 2 years who've been hospitalised because they've not previously been exposed. Clearly we've known about RSV for the last 60 or 70 years, and there's been a tremendous amount of work to try and understand why it causes such significant disease in young children and also in older adults. Despite this, we're still yet to have a widely available antiviral or a widely available monoclonal antibody or vaccine. There's many things in the pipeline, and one would hope that in the near future something will become available to either prevent severe disease or treat children with RSV infection. I would hope that on the back of all the work done for COVID-19, that some RSV work can be piggybacked onto that, and we don't lose momentum with all the knowledge we've gained around respiratory viruses due to the pandemic. good example would be the mRNA vaccines, which have been shown to be very efficacious for COVID-19, that hopefully that platform and technology can be used for RSV to try and prevent disease in the most vulnerable children and adults.
With RSV, I think the biggest thing is that people don't know about it. Parents don't know about it. So when we talk to healthcare professionals here in the UK, particularly those that are working on paediatric units, they'll say, oh gosh, we've got loads of bronchiolitis cases. They call them bronchi babies. We've got wards full of them at the moment. But yet parents, when you talk to them about it, don't know much about it. So I guess my advice to parents is to make sure that they're aware of the signs and symptoms of RSV, and that if their baby, even if they have a cold and they're a little bit snuffly, is that if that develops to where they're struggling to breathe or it's pulling here, that tug there, and also crucially with babies, it's around fluids and keeping food down, is that they are able to keep an eye on that and seek medical advice before their babies get too poorly. And I know with us, with our babies, it was the fact that every time they coughed, they vomited, which meant that they weren't able to keep their fluids down. So they were becoming very dehydrated. And ultimately, a milk-only fed baby, so a baby under 6 months, is so reliant for their hydration and their nutrition and their general well-being, for them to have their regular feeds. And if that is not happening, then they need medical intervention. And I just think parents need more information on that. I think we need to know more about it, and particularly as we come into the time of year where RSV is much more prevalent and this spike is emerging, is that parents are aware of it, know what to look out for, and know when to get medical help.